Yes, this is Gary Thompson calling. In regards to some training materials that's going across the Ontario about opioid overdose.
Training? We don't have from Public Health Ontario?
Well, it's the Ministry of Health and everyone on the pub
Okay.
and what is it, public
So you're calling Public Health Ontario, not the Ministry of Health?
Yeah, I know. But you guys know about it for years. I've been into your office. They've taught millions of people all the signs of a respiratory emergency and then give chest compressions only. So they're killing everybody in this province. Jeepers. You guys look at my LinkedIn page all the time, and so does the Ministry of Health. There's a private members bill in front of the legislature, Natalie Cussendola. She's an RN from Mississauga. She's a member of the legislature. And my brother-in-law, emergency physician at the legislature, over and over, rescue breathing. Doris Grenspun, the CEO of the Registered Nurses Association, she mentioned Brad Chapman's coroner's jury inquest. And the jury's verdict was, do not deny rescue breathing from anyone. I made a deputation to the Board of Health on September 23rd. They lost the video recording of my deputation. They did not submit the references to my submission. After much prodding, they finally put the references up to my submission because my submission was useless without the references. Andy Pringle, the chair of the Toronto Police Services, was there on the day I made my deputation. He says, Gary, I've never heard such nonsense. Well, you go to the Ontario Chiefs of Police website. They have instructions on persons comatose, change Stokes respiration, cyanotic, meiosis. Give them chest compressions. I phoned up the Chiefs of Police. I says, why are you doing that? He says, yeah, we should stop doing that. They've been doing it since 2015 and it's still up on their website. The Mayor of Toronto and the Medical Officer of Health, the acting Medical Officer of Health at the time, Dr. Barbara Yaffe, had a press conference. She said, rescue breathing is the most important part. And John Tory says, this is what's causing people to lose their lives quite literally. Yeah, the Executive Director at Health Canada, Heidi Jackson, she got canned in January 2019 for blowing the whistle because Health Canada removed rescue breathing from their protocols. And they're handing out wallet cards to Canadian citizens, all the signs of respiratory emergency. No rescue breathing. When Health Canada used to last September, it said start with rescue breathing, of course. I don't know why you're not concerned for your own life, guys, suffer an injury or illness. Because they've empowered millions of people what they think is a life-saving technique. And they're eagerly doing it. Hello?
Yeah.
So, do you know about this issue? Everybody does.
Well, so it sounds like you have informed the appropriate groups and organizations about, I guess, your position.
My position, there's 100 million references in the medical literature.
Okay, so you've informed the people that need to know about what the information is.
Yeah.
And so I'm sure that they will have considered it and will make whatever recommendations that they feel is needed and necessary.
Well, no, they knew right from the very beginning. These are doctors.
Okay. That may very well be, but you've already informed people, so I'm not exactly sure what the purpose of this call is right now.
The purpose of this call is to stop teaching it all across these public health districts in this province.
Then I would suggest that you call the Ministry of Health.
Well,
the Public Health Ontario does not have administrative oversight over the public health units in Ontario.
Yeah. Well, okay. Well, why aren't you it's costing you hundreds of millions of dollars if somebody left with permanent neurologic impairment and your tax dollars paying for this. And then there's
I suggest you call the Ministry of Health.
They already know about it. Okay, the Ministry of Health. Here's the Ministry of Health. Here's the Ministry of Health. Brad Chapman's coroner's inquest. A man named Sean Court, he's the director of policy for the Ministry of Health, and was on the stand being questioned by the city lawyers. His response was, I don't know, I don't know, I don't know. I want my lawyers, go ask Eric Hoskins. Dr. Elaine Davila on the stand being questioned by the lawyers. I'm not a resuscitation expert. Ask the nurses, they know what to do. And then she says, Doug Ford's policies is killing people. Aaron Orkin, the co-author of the 2015 AHA guidelines, on the stand. Rescue breathing saves lives. Yeah, and they're still teaching millions of people to give chest compressions only. It's in the newspaper. 95% of articles you hear about overdose, it's chest compressions. It's funny, you make yourself sick saying nothing, you know that, eh? Denial. I watch you and you start shaking. I go to conferences with medical doctors, they start visibly shaking. So, okay, maybe you want to find somebody with a brain cell and talk to them and say, hey, we should stop doing that.
Okay, thank you for your call.
You have a great day. Okay. Another nut. Another nut.